The heart never rests. Even while you sleep, it is already at work on its next beat. At a modest 60 beats a minute, that is 86,000 contractions a day. To pay for that labor, the heart must make and remake its energy currency, ATP, about 10,000 times every 24 hours. 6,000 grams of energy every single day. This is a documentary inspired by the Sinatra Solution, Metabolic Cardiology, the 2011 edition of a book by cardiologist Stephen T. Sinatra. It is not medical advice. It is the story of an idea that failing hearts are often energy-starved hearts, and that nutrition, used with conventional care, can feed the engine inside the cell. Despite decades of drugs and surgery, cardiovascular disease remained the #1 killer of men and women. For roughly half of those who suffer a heart attack, the first symptom is sudden death. Prevention, Sinatra argued, had to reach the membrane of every cell, a wall that must let nutrients in and toxins out, or the organ fails from the inside. In 1981, a young mother named Joan was rushed to the emergency room. After pregnancy, her heart had collapsed into failure. Conventional teaching said heart muscle cells do not renew. Survival in heart failure was often worse than many cancers, half of patients dead within 5 years. Joan was listed for transplant. Sinatra had been reading Carl Folkers of the University of Texas. Folkers had found Coenzyme Q10 consistently low in heart failure patients. The strategy was experimental, a nutritional supplement. She was waiting for a new heart anyway. He started her on Coenzyme Q10, then vitamins, then magnesium. She improved. When a heart became available, she followed her intuition and turned the transplant down. Over years, he added L-carnitine and later D-ribose, the combination he would call the awesome foursome: Q10, carnitine, ribose, and magnesium, working, as he put it, in the engine room of each cell. Decades later, Joan's ejection fraction held in the high 40s, just shy of normal. No shortness of breath, arrhythmias controlled. She was his poster girl for metabolic cardiology. In 2011, he wrote that it was the 30th anniversary of that approach. Swedish research had shown cardiomyocytes do renew, slowly, about 1% a year in early adulthood. He wondered whether feeding ATP had bought time for that quiet repair. Adenosine triphosphate is a small compound: adenine, the 5-carbon sugar D-ribose, and 3 phosphate groups. The bonds between those phosphates are loosely held high-energy bonds. Split them, and work happens. In cells, magnesium almost always rides along, softening ATP's charge so it can move and dock. Fatty acids are the heart's preferred fuel. L-carnitine acts like a freight train, shuttling acyl groups across the mitochondrial membrane. Inside, beta-oxidation and the Krebs cycle strip electrons. Those electrons travel the electron transport chain. Coenzyme Q10 is the spark. Oxygen is required. The payoff is oxidative phosphorylation. Phosphate snapped back onto ADP, ATP reborn. When the pump is weak, ankles swell and lungs fill. Scar and cardiomyopathy leave too little healthy muscle. Sinatra's triad, later a foursome, was meant to restore synthesis and recycling of ATP so the heart could contract, and just as important, relax and refill. He told colleagues that idiopathic heart failure was often nutritional idiocy, deficiencies conventional cardiology still barely considered. Coenzyme Q10 was identified in the mid-20th century. Merck stepped back. Japanese clinicians, then Folkers and Lattaru, linked deficiency to gum disease and to the failing heart. By 1974, Japan could manufacture it at scale. Sinatra's later dosing, from his book, ranged from about 90 milligrams a day for prevention to several hundred for heart failure, higher still in severe cardiomyopathy, always with the caveat that delivery form matters and that stopping a working dose can bring symptoms roaring back. Statins, he warned, can interfere with the same pathway that makes Q10. L-carnitine ferries fuel and helps clear toxic acyl groups. D-ribose is the sugar backbone of ATP itself, the missing link when energy pools are drained and the cell cannot wait days to rebuild them. Magnesium is the unsung ion clipped to ATP, a natural calcium channel helper, often low in patients on diuretics. This is complementary medicine, as Sinatra practiced it, not a replacement for a cardiologist, a crash cart, or a needed operation. The book reprints case histories and citations. Independent large trials have been mixed or incomplete for some of these agents. Anyone considering supplements must speak with their own physician, especially if they take warfarin, statins, or heart failure drugs.
Joan said she was still here because of a relationship, and because she was willing to try. Nothing is impossible. As he gave her hope, she gave him the courage to offer the same nutrients to other so-called hopeless patients. The Sinatra solution is, at bottom, a demand to think energy, energy, energy. Healthy membranes, mitochondria that can still spark, a heart that is not only a pump, but a living tissue that turns over, slowly, if we keep it fed. This film is an analysis and adaptation of published ideas from Stephen T. Sinatra, MD, FACC, with an introduction in the book by James C. Roberts. It is educational, not a prescription. If you have chest pain, swelling, or known heart disease, seek emergency or specialist care. Then, if you wish, read the science, ask better questions, and decide with your doctor whether metabolic support belongs beside, not instead of, the medicine that already keeps you alive.